Fine. Okay, and this is going to seem very weird,
Okay.
and I'm going to try to hold that right there, and you just look at me.
Look at you.
Don't even look at the camera.
Okay.
If you can first say your name and spell it for me.
Sure. Matthew Nichols, Matthew Nichols.
Okay, and would you mind shutting the door behind you? Sorry, just in case it gets too loud. Okay, first of all, what went down here today?
So today we had physicians and nurses who support the Crohn's and Colitis Foundation of America present to answer phone calls, answer questions from people who have questions about Crohn's and ulcerative colitis. Talk about their treatments, the symptoms they're having, the journey they've been on, and help them figure out where they can get more information.
Phones are ringing off the hook.
Yeah, it was really good. I was very encouraged.
Were you surprised?
Well, you know, I think a lot of people have questions about their body, their gastrointestinal tract, and they're hard questions to ask, so I think this was a great opportunity for people to anonymously and ask those questions and find out where they can get more information.
I kept hearing the majority of the questions were IBS.
Yeah,
Is that right?
Yeah, so irritable bowel syndrome, it's easy to confuse that with IBD, which is inflammatory bowel disease. They both can give symptoms of the GI tract, abdominal discomfort, changes in the bowel movements, that type of thing. It's important to talk to your doctor about any symptoms that you're having so that you can figure out what's the best way to approach those symptoms. How do you figure out what exactly you're dealing with?
I'm going to brag on you, and I'm not trying to embarrass you by any means, but I think you are such a good doctor, whether you are a GI doctor or a MD, because some doctors, they just don't have good people skills. I'm sure you know what I'm talking about when I say that. Is it more difficult when you're talking about the digestive tract and BMs, because it's such a sensitive subject for some people?
Well, the way I try to approach it is I talk about it like I'm talking about anything else in the day. It's something important to address because these symptoms can really dominate the way somebody lives their life. So you just try to bring it out. These are the issues that we deal with, and really trying to get to the root of it as fast as possible so we can make people feel better.
I would think that you meet some people who at times are really emotional.
Absolutely, absolutely. You know, a good thing that the Crohn's and Colitis Foundation has is a group of support groups that people can meet other people that are dealing with the same issues that they're dealing with to ask what has worked for them, what are the hurdles that they've overcome. You know, there is somebody out there who has gone through the same things that you're going through. And so the support groups through CCFA is just a great opportunity for people to connect with others on the same path that they're on.
Any advice for anyone who may be questioning? Is it just get in touch with a GI doctor because they know what they're talking about?
Well, certainly there's lots of avenues for information. The Crohn's Colitis Foundation website, which is ccfa.org, is a fantastic resource for people to find out questions about Crohn's disease, questions about ulcerative colitis, general GI questions, and certainly links into medical providers in the area who are knowledgeable.
That's all I got.
Terrific.
Great.